Welcome to Pandu Pharmatech channel. In this video, how to remember drugs easily and how to identify a drug. Particular drug has a particular category, particular suffixes. In this, for example, ACE inhibitors have suffix prils for captopril, and benzodiazepines have two suffixes, diazepam and azolam, triazolam, diazepam, triazolam. And next, first drug afil has a suffix afil, phosphodiesterase type V inhibitors, example sildenafil and tadalafil, and these drugs inhibit the phosphodiesterase V enzyme and cyclic GMP converted into GMP and mainly produces the vasodilation. In this suffix afil is a, and second drug azepine, dibenzazepines, and these are the benzodiazepines and carbamazepine, oxcarbamazepine, mainly anti-epileptic agents used in the treatment of anti-epileptic agents. And azoles, antifungal agents, these are imidazoles and triazoles, and coming to imidazoles, clotrimazole, ecanazole, miconazole, ketoconazole. Coming to triazoles, itraconazole, fluconazole, posaconazole, voriconazole. These are the antifungal agents. And fourth drug, azosin, alpha-1 blockers, and prazosin, terazosin, doxazosin, and these are produces the direct vasodilators. These drugs act as a direct vasodilators. Okay, bendazoles, benzimidazoles, albendazole, mebendazole, thibendazole, and these drugs act as a antihelminthetics. Bendazoles act as a anthelmintics. Caine, local anesthetics. Cocaine, natural plant alkaloid. And coming to esters, benzocaine, procaine, chloroquine, and tetracyclines. Amides, lidocaine, bupivacaine, pilocaine, rapivacaine, mepivacaine. These agents act as a local anesthetics, and cocaine is a natural plant alkaloid. Capone, COMT inhibitors, entacapone, tolacapone, given along with the levodopa to inhibit its peripheral metabolism. Catecholamine O-methoxy transferase inhibitors. Cillins, penicillins, penicillin G, penicillin V, ampicillin, amoxicillin, methicillin, piperacillin. Penicillin derivatives and used in a gram positive and few gram negative infections. Okay. Cyclines, tetracyclines, oxytetracyclines, chlorotetracyclines, doxycyclines, minocycline act as a antibacterials by inhibit the protein synthesis. Okay, cyclines. Dipine, dihydropyridine, and nifedipine, amlodipine, felodipine, nicardipine, one type of calcium channel blockers that act as directly vascular smooth muscle. Okay, dipines. Floxacin, Fluoroquinolones, ciprofloxacin, norfloxacin, ofloxacin, mixifloxacin, and nalidixic acid. These agents inhibit the bacterial topoisomerase enzyme. Floxacin. Formin, Biguanides, metformin, one of the drug that reduces the hepatic gluconeogenesis. Giline, MAO B inhibitors. Giline, rosigiline inhibit the metabolism of dopamine in CNS, hence used to treat Parkinson's disease. Gilines used in the treatment of Parkinson's disease. Okay. Glinides, non-sulfonyl ureases, repaglinide, nataglinide, structurally not similar to sulfonyl ureases but act like a sulfonyl ureases. Glinides, sulfonyl ureases. Okay. Gliptins, DPP IV inhibitor, fourth inhibitors, sitagliptin, soxagliptin inhibit the metabolism of incretins like GLP protein. Okay, GLP protein. Glitazones, PPAR gamma inhibitors, and pioglitazone, rosiglitazone act on nuclear receptor therapy, affect hepatic glucose turnover. Okay, next one. Gravir, integrase inhibitors, raltegravir, dolutegravir inhibit the merging of viral DNA with host DNA, inhibit the viral DNA with host DNA. Eposide, podophylotoxins, etopicide, tenepicide inhibit the topoisomerase 2 enzyme, Leucost, leukotriene antagonist, montelukast, jafarlukast, used to treat allergic rhinitis. Okay. Next, MAO B, monoclonal antibodies, rituximab, cetuximab, abceximab, and transjumab, omalizumab. Few of the drugs act anti-cancer agents and few act biological modifiers. Okay. Next one, metazolin, nasal decongestants, oxymetazoline, oxalometazolin, imidazolin derivatives that act a alpha-1 antagonist. Navir, protease inhibitors, saquinavir, indinavir, ritonavir, amprinavir inhibit the viral protein synthesis. These drugs inhibit the viral protein synthesis. Navirs inhibit the viral protein synthesis. Nidazoles, nitroimidazoles, metronidazole, tinidazole, ornidazole used to treat diarrhea and amoebic infections. LOLs, volals, beta blockers, and non-selective propranolol, nadolol, timolol, selective atenolol, metoprolol, esmolol, oxalopropranolol amines. Okay, LOLs. These are LOLs. Penams, carbapenems, imipenem, meropenem, ertapenem act like penicillins and inhibit the cell wall synthesis. Platinum compounds, cisplatin, carboplatin, oxaplatin. These agents used in the treatment of cancer. Prazoles, proton pump inhibitors, omeprazole, rabeprazole, pantoprazole, lansoprazole inhibit the gastric acid secretion. Okay, gastric acid secretion. Prils, ACE inhibitors, captopril, lisinopril, ramipril, enalapril inhibit the conversion of angiotensin 1 to angiotensin 2. Okay. Pristin, streptogramins, quinupristin, dalfopristin inhibit the bacterial protein synthesis. Okay. Quinine, aminoquinolines, chloroquine, mefloquine, primaquine, both 4 amino and 8 aminoquinolones. Okay. Rubicin, anthracillin antibiotics, doxorubicin, daunorubicin, epirubicin, idarubicin inhibit the DNA polymerase enzyme. Okay. Satran, ARBS, and losatran, valsatran, omalsatran, telmisatran antagonize the angiotensin 2. Okay. Cetron, 5H serotonin antagonist, ondansetron, granisetron, tropisatran, dalsatran used as antiemetics. And statins, HMG Co-A reductase inhibitors, simvastatin, lovastatin, rosuvastatin, atorvastatin reduce the LDL cholesterol in blood. Okay, reduce the LDL cholesterol in blood. Statins. Tecan, camptothecins, topothecins, erythropoietin inhibit the topoisomerase 1 enzyme. Okay, tecans inhibit the topoisomerase 1 enzyme. Thiazides, diuretics, chlorothiazide, hydrochlorothiazide, benzfluorothiazide act on a distal convoluted tubule and inhibit the sodium and chloride symport. Okay, diuretics. Okay. Thromycin, macrolides, erythromycin, clarithromycin, azithromycin inhibit the bacterial protein synthesis by inhibiting the translocation. Okay, thromycin. Next one, tidine, H2 antagonist, cimetidine, ranitidine, famotidine, nizatidine inhibit the histamine and mediate the gastric acid secretion. Okay, tidines inhibit the histamine. Okay. And triptans, 5-HT1D antagonist, sumatriptan, rizatriptan, almotriptan, zolmitriptan used to treat migraine and headache. Triptans used to treat migraine and headache. Zolamide and carbonic anhydride inhibitors, acetazolamide and drozolamide and used to treat glaucoma and mountain sickness. ఈ ఇన్ఫర్మేషన్ కనుక మీకు నచ్చినట్లయితే లైక్ చేయండి, సబ్స్క్రైబ్ చేయండి అండ్ పక్కనే ఉన్న బెల్ ఐకాన్ను క్లిక్ చేయండి. మీ ఫ్రెండ్స్కు షేర్ చేయండి. థ్యాంక్ యూ ఫర్ వాచింగ్.